a different topic given to me, transforming your orthopedic practice, clinical excellence, patient trust, and modern growth strategies. I know. Let me just take you through this particular talk. Why this talk actually matters? So, because young surgeons today face a lot of competition because more and more number of orthopedic surgeons who are coming, and challenges related to uh, you know surgical expertise as well as competition, and a shifting landscape in orthopedics like what we are discussing today. So more of technology which is playing coming into play. So starting point of orthopedic journey of any successful surgeon or any surgeon is the zeal and passion. Every successful career begins with genuine passion, zeal, which has to be maintained, and identify your interests and focus on them. So especially uh, and the most important thing is to have this discipline, committed and focused practice separates good surgeons from exceptional ones. So master the fundamentals, that is the most important thing, and being a strong foundation in core orthopedic principles and surgical techniques creates the bedrock for specialized expertise. Once you have the core principles, any new technology which comes, you can easily get acclimatized to it and then take it forward. So growth follows excellence. When you prioritize clinical mastery and patient outcomes above all else, practice growth becomes automatic. So, the core values are there in strengthening your passion and expertise. So, these are the main pillars of success: clinical excellence, patient trust, and modern and ethical growth, which is playing a big game nowadays. And these are the foundation for orthopedic practice. The most important is, first of all, is clinical excellence. So invest in yourself. So invest in rather than investing in technology, invest in yourself first to learn the principles, attend course, maximize your knowledge, and nowadays you have got all kinds of uh, you know tools to have maximize your knowledge. So clinical excellence isn't just goal; it's an essential foundation which every successful orthopedic practice is built. Without no marketing strategy or growth tactic will last without this particular phenomenon. So outcomes first and outreach next. Prove yourself and to yourself, prove yourself to yourself, and then outreach. So and building surgical mastery is relentless skill development, as I mentioned, and it is continuous process which should go on till your last day of practice. And structured learning, you've got various types of learning nowadays. So you've got fellowships, you've got courses, you've got conferences like this, you've got workshops. So and even on mobile you can learn nowadays. You've got online fellowship programs, and master the fundamentals. That is the most important part of becoming a successful surgeon. And techniques, but what matters is how you apply it on that particular patient, and that decision make gives the outcome. It is like Karna knows how to use Brahmastra, but he forgets at the time of right time where he has to save himself and uh, kill the opponent. So he has lost the battle. So just having known is not enough. You should be knowing how to take the right decision for that right particular patient. So So just let me take through one particular case example. This is from 2010. A 20-year-old male construction worker fell from fourth floor, and that was the picture, and that was the clinical picture. Grade 2 open fracture. By the time, internal fixation for open fractures was like a rare scenario. So I had to open this, debride it thoroughly, if you can see that. And since he fell into the cement concrete mixture, his distal end of proximal fragment was full of mud, which I had to excise it. So during debridement. So if you can see that, so the second picture, distal end of the proximal fragment was cut, and then I did a, primary internal fixation, and followed by secondary after, by that time I started moving the joint. I got back the movements, and after 6 weeks went ahead and did a grafting. The cement spacer to start with, and that is during intramembranous grafting, and that is 2 years outcome at that time. Still patient comes to me for follow up. So what I mean to say is, once you know the surgical principles and start applying any new thing to be applied, you can develop on the situation of that particular patient scenario. And this particular patient could get full range of movement for the reason that he underwent a primary internal fixation on day one. And from then onwards, most of my open fractures, primary internal fixation is the treatment. And impact of fellowships and global exposure. So this actually broadens our perspective. So what I learned in fellowships, abroad, was more than the surgical technique and surgical strategy, the systems, how the systems actually work. So you can actually come back and replicate same scenario here, by which you can improve your standard of care. So global exposure transforms good surgeons into exceptional ones, and so these are the places where I have been trained, and with my mentors in abroad. And to have the mentor uh, here is also very important. I have my teachers, Dr. Anil sir, Ravinath sir, and get associated with people, you want to become like. So these are the pictures. You can see Vijay Raghavan sir, A.S. Rao sir, Y. Krishna sir, Ivy Reddy garu, and many others. So get associated with people who you feel are successful, right? And lifelong learning. So thoughtful technology adoption is very very important for nowadays practice. It's not just for practice alone, but to clinical outcomes, but to reach people. So embrace better methods and dynamic protocol updates, which will happen only when you go abroad and learn systems which are going to play a significant role in your future, surgical practice. So evidence over eminence. This has to be kept in mind. Don't be rushing to become eminent surgeon. So once you start practicing evidence over a period of time, obviously you are going to become a prominent surgeon. And so consistency improves outcomes and reduces variability. This will happen only by inculcating protocols in your regular practice. Let it be a simple nailing surgery to joint replacement surgery. Communication is a skill. This has to be, all of us need to learn this particular technique to make the patient satisfied and give them the most, best outcome, which is not sufficient when you don't communicate it well. With the most important part is patient listening. So if you are able to listen to your patient, So they start listening to you. Otherwise, it is, in today's practice, it is very difficult. Even if you have done an excellent surgery, that doesn't mean patient is satisfied. And most important thing is be honest to your patient. Whatever, let it be complex surgery. You might be doing 2 or 3 surgeries, or if something goes wrong also. So when you communicate to the patient honestly, they always take it with whatever experience which I have. Here is a 47-year-old gentleman presented to me with 5 months post-op hemiarthroplasty done elsewhere. You can't see any joint space there, and there is proximal migration. And this part, that is the first X-ray, and this is 5 months X-ray. So that is the migration which has happened. And for him, ESR, CRP were elevated, and when I aspirated, there was a pus which was sent for culture, and which was negative. And thereafter, I did a spacer. This is from 2009, and after 6 weeks, he was given empirical antibiotic for 6 weeks. But in spite of that, he had positive ESR and CRP nearly normalized, but intraoperative frozen section showed more than 10 pus cells, for which I had to convince the patient. Patient was poor. You have to communicate that, so, and convince them for second spacer. If you can see, I have applied a second spacer. But when you are honest, they take it. And that's when extended culture has shown pseudomonas, which was sensitive for colistin. And later I have done the revision. Now it is more than 10 years post-op. He does everything. He does prayer also on the ground. And so another important pillar is ethical practice. So you have to develop long-term trust over short-term gain, which is very, very important. Don't just depend on immediate prominence kind of a advertisement, or going on social media, but have a ethical boundary. And building a relationship based on integrity creates loyal patients, and your bank balance. So they come, and they get the patients. And more the best referral is by the patients all the time. And take only right indicated surgeries. So whenever you are skeptical, wherever you are unsure, better do not operate, even in spite of patient wants surgery. When you are not convinced, please do not operate. And conservative option whenever it is appropriate. And be completely transparent to the patient. So let us say if you have a patient come to your casualty, and he is in significant pain, that doesn't mean you need to operate on that particular patient. So have a right indication, then obviously you get a trust from the patient side, and it won't stay with that particular patient, it spreads. So here is a patient who had a major trauma, run over by a bus, and underwent bilateral amputation, but only after 1 month of struggle in ICU. He had mucormycosis of both the lower limbs, and say mucormycosis in the lung and the elbow. And so all the all the rest of the specialists were involved, and we have counseled that the patient is not going to survive. You can take the patient home. By that time, he has spent a huge amount. And once we conveyed this next day from next day morning onwards, he started improving, in fact. And now he is appearing for civils. This particular patient, he is bilateral amputee, the middle person. So success, what we feel success is not success, may not be the success for the patient. Sometimes you have done a great job on a patient, but he comes, best fixation for the pelvis, he comes with finger pain. So you have to communicate what you have done. And for a surgeon, it is functional scores and radiological outcomes for patient satisfaction and reaching the expectations. So this will happen only by communication and accessibility. So nowadays, the bigger challenge is you have to be accessible to the patient to make him happy. and effective communication, as I mentioned, and make them part of the treatment strategy. You just don't own the treatment strategy. You involve them during surgical decision making. And so, as I mentioned, word of mouth is the most effective and time tested way of getting more practice than anything else, and which gives you more satisfaction. Ethics and outcomes define your reputation, and exceptional care creates ambassadors who champion your practice. So I keep seeing after 10 years, 12 years, they come. Yesterday, a patient came to me in my OPD. I have operated 12 years back, total knee replacement, and she brought her sister. I offered robotic knee replacement. Then she said, "Sir, we want your hands." So I don't want robot. So you get such a kind of a patient, and so research should go hand in hand with whatever clinical outcomes you are giving, and it improves patient care research and builds professional credibility, and evidence convinces skeptics, and engaging in research transforms your practice. I'll just show you, any publication will actually make you wise than anybody else. So academic engagement will actually help the surgeon himself by, as it opens the network opportunities, and teaching deepens the understanding. So now the trend is towards team build up. You have got masters who have built up teams. So nothing happens without building a proper team. It may be with your associates or with your teammates, like your secretary, your technical staff, and scrub nurse. Everybody is part of the team. Unless their contribution, you cannot get any successful. You cannot reach the success. And most importantly, Dr. Krishna Kiran keeps talking, keep yourself healthy to give more to the society. It's not just, getting into the work and burnout in your work. So keep yourself safe so that you can give better to the patient. So ultimately, it is, happy patient and a happy surgeon. Thank you.